The race for a coronavirus vaccine intensifies as Pfizer says it will seek FDA clearance within days.
Moderna is also a front runner, reporting their vaccine is nearly 95% effective. Joining us now with a closer look at both of these vaccines is Dr. Nicholas Testa. He's the Chief Medical Officer with Dignity Health, Southern California. Doctor, good afternoon.
Good afternoon.
So to start off, just give us a quick rundown on how these vaccines work.
So they're unique vaccines. They're what's called mRNA vaccines. So unlike previous vaccines where we would give the patient a small either deactivated version of the virus or a portion of the virus, what we're doing is we're actually giving the patient a part of what's called the messenger RNA. It's actually part of the transmission chain. So it tricks the cell to produce parts of the virus that then allow us to generate antibodies. So it's totally new science that we've never actually used on this scale ever.
And are they different from one another?
So I don't know enough about the specific mechanics. I will say that they are both mRNA vaccines. So from that category, they are the same. As far as sort of the idiosyncrasies of both, that I can't give you the details on just because I don't know. It hasn't been published yet.
All right. Of course, a lot of people concerned. Number one, are they safe? And what about side effects?
Yeah, so safety is obviously going to be paramount for two reasons. One, we've never seen a vaccine moved so quickly through the preparation phase. And then two, we're going to be giving it to a lot of people. So I will tell you some reassuring things. Vaccine complications are most typically seen within the first 2 to 3 months. That's a safety profile that we'll be able to witness. So I'm feeling very confident about the safety of these vaccines. I understand people's apprehension, but from the safety profiles that we've already seen from these two, the Moderna and Pfizer, most of the complications we're seeing are pretty, I don't want to say, they're pretty routine. Soreness in the arm, fever, things that people typically see after vaccines. Nothing life-threatening.
So let's talk about where we are right now with these vaccines. What are the next steps?
So the vaccines have been, the information's been released through a press release, which is great, right? So we have the basic information. So the next thing that the company is going to need to do is apply for an emergency use authorization, which is the federal government saying, okay, you have not completed what we would typically expect for a full approval, but because this is an emergency situation, you can release it with consent if the patient is willing to take it. So we do this with other products too. There are other products out there, just never anything as broad as this. Once that EUA is approved, both these companies have started stockpiling vaccines. They're ready to ship. So I would expect that our hospitals and other delivery systems will start seeing shipment of these vaccines 24 hours after the EUA is approved.
All right. So once people take the vaccine, if they choose to take it, these precautions we have now about wearing a mask and social distancing, is that going to continue?
Yes. So the vaccine is going to be distributed to frontline providers first. ICU nurses, ICU doctors, firefighters, paramedics, people who are out there seeing this up close and personal. Then it'll go to high-risk patients. Then it'll go to the wide community. It will take us months to vaccinate the entirety for us to get herd immunity. So I will anticipate we will be seeing some level of restrictions in place well into 2021. So just because the vaccine starts doesn't mean we're done with this, but it's a very good step forward.
All right, Dr. Nicholas Testa, thank you so much for helping us clarify some of that information. We appreciate it. Have a great afternoon.
You too.